like to welcome the Time to Act Data Navigator tool. This is an incredible tool that shows how COVID-19 led to the delay in care for cancer patients. We have data regarding prevention, regarding screening, regarding diagnosis, treatment. This tool shows very important figures and unsettling figures in the sense that it shows that there were less than 30% of cancer diagnoses. Patients stopped receiving appropriate treatment during the pandemic, and 20% of patients had a delay in the screening due to COVID-19. Less 30% of cancer diagnosis does not mean that we managed to decrease by 30% new cancer cases. What it means is that now we're going to face a delay in diagnosis, and this will have important impacts in the morbidity and mortality of the patients. We need to do more. We need to do it fast. COVID-19 uncovered what are the fragilities of healthcare systems. It is now up to the member states to rebuild based on what were the main difficulties faced, so that when a new pandemic hits, when a new cross-border health threat arises, it is important to safeguard accessibility to appropriate care at all different stages of the disease. I would like to welcome this tool also when we are speaking about the importance and the new regulation for the European health data space, where we're trying to digitalize health across the EU. This is a tool that shows the incredibilities that the digital world has to offer when it comes to health, and to better guide policymakers and different stakeholders to take the appropriate decisions when they have access to the latest data. This data will then turn into information, and that's where we can take appropriate action. We must not lose any more time. It is important to understand that accessibility to healthcare systems is not safeguarded. It is safe to go to your family doctor. It is safe to go to your screening, to your consultations. Don't delay the time that it gets for you to get appropriate care, because this will have a tremendous impact on the evolution of the disease. There's still a long road to be covered when it comes to beating cancer in the EU. We now have the European Beating Cancer Plan. We have a report by the European Parliament. It focuses on the 4 pillars, and also it focuses on one of the main tools that we need to safeguard when it comes to cancer, which is prevention. We know that 40 to 50% of that could be prevented, and we also know that the European Union has competences when it comes to protection of public health. So it's important to legislate strongly on those known risk factors of cancer. I would also like to highlight that we still don't know 50% of the causes of cancer, and for that it's important to have the instruments available for research and science to uncover what are the other 50% of causes of cancer. Together, we are together in this fight, and together we hope to beat cancer in the European Union and for citizens to have better health and well-being. Thank you very much for the opportunity to send you this message.